Samantha Marsh, and today's session is about how pharmacists can identify and address vaccine complacency and fatigue among at-risk adults. So first of all, I'm going to define what vaccine complacency and fatigue are, how these both might influence vaccine uptake, particularly among those high-risk groups, such as older adults, people living with comorbidities, and pregnant individuals. I'm going to talk about how pharmacists might be able to identify when people are showing signs of complacency or fatigue, and then also suggest some strategies that pharmacists may use to address vaccine complacency. And then finally, I'll just share some resources and some additional evidence-based resources that interested pharmacists may be able to explore to learn further about the topic. So to get started, I wanted to start about where vaccine complacency sits within the area of vaccine hesitancy. So the SAGE working group developed the 3C model of vaccine hesitancy. And within that model is confidence, complacency, and convenience. And here today, we're going to focus on complacency. Vaccine complacency arises when there is a perceived low risk of the vaccine preventable disease. So people assume that they don't need it and that other health issues will be more important than getting the vaccine. Now, information and knowledge gaps is actually quite an important driver of vaccine complacency. So we're going to just start out by discussing some of the things that perhaps people don't know about influenza. So around 290 to 650,000 people die each year from influenza. And all age groups can be affected, but those at greater risk of severe disease or complications include pregnant people, children under the age of 5, older adults, and those living with chronic medical conditions such as cardiac, pulmonary, renal, or metabolic diseases. And also those people who are taking immunosuppressants. Complications of the flu can include pneumonia, heart attack or stroke, and worsening of existing diseases. So what are the factors that give rise to complacency? So we know that people thinking that the risk of themselves contracting influenza is low, that's a barrier. If people think that the risk, if they do contract influenza, but they won't get very sick, it's also another barrier. And also people thinking that those around them won't be negatively influenced by it. Now, vaccine fatigue is a concept that has received much less attention in the research compared to vaccine complacency. Although since COVID-19, it's kind of become more of an important issue. Vaccine fatigue was recently defined as people's inertia or inaction towards vaccine information or instruction due to perceived burden and burnout. So while vaccine fatigue certainly isn't new, it does seem to be more pronounced during and after large infectious disease outbreaks such as COVID. So there is always also some overlap between complacency and fatigue, although they aren't the exact same concept. And importantly, unlike people who hold strong anti-vaccine views, which are often considered more of a permanent trait, vaccine fatigue can be transitory and is more common in people who hold pro-vaccination views. So what factors give rise to vaccine fatigue? So when there is high frequency of immunization demands, when there are vaccine side effects or perceived side effects, and also misconceptions about the severity of the disease itself and the need for actually getting vaccines. And so this is quite important when we are considering the flu vaccine. So with the flu vaccine, you require seasonal vaccinations, which increases that load, that burden from vaccines. In many people, the virus is asymptomatic or mild, so people don't consider that it's important enough to receive a vaccine for. We also tend to, in day-to-day conversations, really misuse the word flu. So also, you often hear people refer to themselves as having the flu when they just have a cold. And there are also misconceptions, such as people reporting getting the flu from the vaccination itself. And finally, there's some issues around effectiveness where we see a changeable effectiveness from year to year. And now these are important because complacency and fatigue obstruct preparedness for seasonal and pandemic influenza. So when considering people's knowledge around vaccines, particularly with respect to complacency and fatigue, it's important to understand that the knowledge gaps that people tend to have are different for different groups. So for example, in older people, they tend to have been exposed to influenza or witnessed people who had severe influenza. So their understanding of the disease and the vaccine is really determined by their personal experience, which they often have quite a bit of. The severity of the disease is often well understood, and they are aware of the vaccine. Now, adults with risk factors or comorbidities, they tend to receive information in health facilities about the importance of vaccination. They're generally well informed because they have this continued contact with their health professionals. But one area which is quite important that might need addressing for this group is that they often view influenza as a complication of a previous respiratory process or disease. So pregnant people, interestingly, they don't identify themselves as being a particularly at-risk group for influenza infection, and they have less knowledge about the disease and its symptoms. And then finally, parents or mothers of young children, again, they don't identify children as being an at-risk group. They often consider influenza to be a strong cold or a heavy cold, and they believe medical professionals can cure their children if they do get influenza. And importantly, with respect to prevention, they really see diet and healthy lifestyles as important measures. So how, as a pharmacist, might you identify people who might be complacent with respect to the flu vaccine? So I've just included some examples here of some phrases that people might use. So if you hear people saying things like, I'm not a member of a high-risk group, flu is just like a bad cold, I've never had flu before, I've got so much going on in my life that flu or the flu vaccine just isn't a priority, and my kid is healthy, so they don't need the vaccine, and only people who don't take care of themselves get really sick with the flu. So what can pharmacists do about it? How can we shift complacency and fatigue with respect to the flu vaccine? So studies show that strong provider recommendations can be really impactful. So the first part is to ask. So for many people who show passive vaccine hesitancy, just asking or recommending vaccination may be all it takes to shift them and their behavior. So this may be particularly important for vaccine complacency, which, as we know, is more transient than other predictors of vaccine hesitancy. The next one I said is write. So there is also some consistent research showing that sending out written vaccination correspondence to members of the community is likely to increase uptake. Now, this information should address the misconceptions around the flu, which we've discussed, identify those who are at greatest risk and maybe tailor messages to them, and explain where and how vaccines can be obtained. And then show. So you can use advertisements and posters within the pharmacy to address misconceptions. And I will share with you in a moment a place where you can get examples of those. So different messages for different groups. Communication could be generalized, or it could be tailored to the audience based on their particular needs and knowledge gaps. So research shows that some of the following misconceptions around flu and flu vaccination are the key drivers behind vaccine complacency. So when you are designing posters or when you're talking to people or writing to them, these are some things that you might want to consider addressing. So first of all, that influenza is a complication of a previous respiratory process, that healthy kids don't get the flu or don't get very sick or die from the flu. If you have a healthy lifestyle, you won't get the flu or you won't get very sick. That the vaccine itself can give you the flu. The flu is just a heavy cold, or pregnant people aren't a high risk group for the flu. So let's talk about vaccines as a campaign that was launched in 2023 in December by FIP, which includes posters and flyers for community members, as well as materials to support pharmacists with their conversations around vaccination needs of individuals, particularly in high-risk groups. And all these materials are freely downloadable, and they can be found here. So just to recap, vaccine complacency and fatigue are detrimental to both personal and public health. However, both complacency and fatigue represent transient states that can likely be overcome with effective communications from health professionals as yourselves. So not only about the vaccine, but also about the disease itself. And these are some further reading and resources, including the link to those posters and flyers. Thank you.